How to treat smelling armpits. I'm talking about the axillary region, your armpit, your folds, maybe under the breast, especially for women with voluminous with big breast, the folds under it, your groin down there, when you sit between the legs. In fact, all skin folds that give bad odor, that make you not comfortable. Some people may not be comfortable sitting around you. A lot of them are armpits. In reproductive health, some people have their relationships jeopardized, brought down, destroyed. They don't get it the best way they wish their relationships to be, because the partner will complain of smelling armpits of the man or of the woman. Unfortunately, sometimes a woman may find it very, very uncomfortable in the arms of a man with smelling armpits. And sometimes it's the other way around. You see, the man is very, very uncomfortable with the way the woman smells, especially from the armpit. When they are together and they do foreplay, they're having fun, they play with each other, and then armpit smell may just spoil the whole thing. Or between the laps, some people, they open their legs like that, and it's vapor even. Something like vapor where actually comes up, and then reproductive health seems to be funny. But very important for somebody to know, and know why you have to take better care of yourself. I can remember when I used to be a student midwife long ago. If I can think very well, around 2004, 2005, during my internship specializing in midwifery. I can remember someday a pregnant woman came for antenatal care, and complained to the senior midwife that was working. We were students under her. That man is long retired now. But her approach to that woman, to me, was not the best. To those of us who were students, was not the best. Unfortunately, some health personnel seem to carry on this kind of negative behavior, whereas they're supposed to be more professional, to instill some hope, to make the woman feel somehow satisfied or comfortable that her problem can be solved. Now, this lady, even after all her examinations during the antenatal care, she came back to the woman while we were standing behind her as students and said, "Ma, in fact, I'm really having some bad odor coming from my vulva, from my vagina. Some secretions, in fact, much and also smelling." And then our mother said, "All right, please climb on the examination bed, remove your pants, do this." In the course of examination, the lady obeyed, remove all of that, climb on the bed, examination bed. Our mother put on gloves to do a vaginal examination. And I looked at her, as soon as she brought her face down towards the legs, the woman opened like that. The vapor, the odor, it was pungent, it was frightening. But this mama instead reacted by, I say, "Madam, you never wash in a single day." That is pidgin in my country here, which means, for how long have you gone without a bath, without taking a good bath, without cleaning up? My dear brothers, with this kind of condition, the woman has complained, secretions, discharges coming right from the womb, through the cervix, through the vagina, to the outside, and smelling. Can you really ask a woman that? Can they wash it with soap? Can they wash it with Omo? Can they? Because this is an infection. The woman is sick, and you are taking the sickness for granted and instead mocking her. Oh, what is that? The health personnel shouldn't do that, because she expects your sympathy. You are supposed to see with her the difficulties, the troubles, the challenges she is facing. So you are the one to assure her and reassure that this is a problem Thank God she has complained. Enough or a lot can be done to diagnose the exact cause and then treat. Assure her that things will be fine. Unfortunately, that was a sad case. That woman, stumbled into tears. She fell into tears and started crying and weeping, and just even came down. She didn't even allow for that examination again to continue. If you are the one, now I have taught it very wise that we can discuss this on reproductive health. Dr. David, reproductive health. My name is Dr. David Ayim. I am in Bamenda, Cameroon. I work there. I work for the government of Cameroon. I am a staff of the National Training School for Midwives, Bamenda. I also lecture as a part-time lecturer at the University of Bamenda, Faculty of Health Sciences. Sometimes this introduction is important to understand why I have chosen to discuss reproductive health with the public. If it doesn't interest you, it is a great interest to some others, to the glory of God. My dear brothers and sisters, how can you treat smelling armpit or groins or skin folds and so on? 1, washing daily and after exercises, meaning that you have to take your bath, a thorough bath that you use soap and clean water. Sometimes better for the water to be warm so that you take time and thoroughly clean your body from head to toe, taking into consideration all the folds, all skin folds, open them, clean, such that even after that, after the bath, you dry them, wipe, clean. Please never leave any folds wet. Don't leave any wetness. Don't leave water to stand in the folds of your body. If you open even under the breast and it is wet, your breast cover it, and as minutes pass, it creates heat. It's a better ground for germs, for microorganisms to grow. In your armpit, if it is wet, it is a better ground for microorganisms to grow. And when germs are growing there, that is where the vapor, the bad air, the smelling odor will be coming. Number 2, wearing clean clothes every day. Please, let your clothes be clean. We always even be advised for cotton material because it's also absorbing, so that it doesn't permit for sweating. Because the sweating is going to be another problem, and it's one of the reasons why the smelling, the odor, even when somebody is taking bath 2 times in a day, it can still produce bad odor if those folds easily sweat. Now, number 3, you can use what we call antiperspirants, meaning the kind of treatment that is against sweating. Example is like aluminum-based compounds that block the pores, the sweating pores, temporarily, making them not sweat much. So people who use these antiperspirants, they do not sweat much. Yet these are available in the market. If you are that type whose armpits fold, sweat a lot, then you need them. They temporarily block the sweating pores, okay, and reducing the rate of sweating. Number 4, treat hyperhidrosis. This is a situation of too much sweating. I've even already mentioned these aluminum-based compounds. They are found in the market that we use them as antiperspirants. You are automatically treating a situation of too much sweating, which we refer to as in medical terms as hyperhidrosis or hyperhidrosis. Now, number 5, keep the skin clean. However, I already mentioned this part, but bringing in the fact that there are certain soaps we refer to as antibacterial or antimicrobial soaps. The soaps used to wash your body. If you can use the medicalized soaps, it will be better. because they also help to kill germs, especially in folds. Now, please, we are emphasizing on that daily bath or even twice bath, morning and evening, for those who are fat and have folds much, or those that suffer from this too much of sweating. Some may even take their bath and in the next 1 hour, 2 hours, they have sweated again enough. Then we advise you use the kind of soap that is medicalized, like what we refer to as antibiotic soaps. Number 6, shave your armpits. Clean the hair from there. Shave your vulva. We always say that down between your legs, please use scissors or a shaving machine that has the teeth that you have hooked there, so that it picks it just to reduce. But don't go and moon it. Don't clean it to peel it to look like your face. It would have been causing another problem. Reduce the hair from your pubic area. From your armpits, you can actually clear it, so that you can apply this, some of these products that will prevent too much sweating and keep you healthy. Now, number 6. Well, I've already said the number 6, which is about shaving. When you shave and there's no much hair in your armpit, the good advantage is that there's evaporation. Even when you are sweating, it's evaporating fast. Air passes there and keep the armpit dry, which is better to keep you healthy. Number 7, regularly wash your dresses and iron. Do not pick a dirty dress and wear again. A dress that you had put on before and sweated, please don't get up another day and still pick it again and wear. There is the risk of infections, and that risk giving you bad odor. Number 8, no tight dressing. Do not wear tight clothing. Just wear cotton material, especially your inner wears, because they absorb. You may be sweating, but they just soak into that material and easily change your dress and wash them, so that you don't have wetness or folds that keep heat, that keep moisture, that is also warm. Bacteria grow there a lot. There are equally this kind of drugs that we refer to as anti-deodorants. Okay, in fact, we call them deodorants, not anti-deodorants. They are antiperspirants. That is against sweating, and so that's why we call them deodorants. Please. They are found in our pharmacies. They are found in our hospitals. You can still get advice. Remember, if you do all of this and odor keeps coming, there is need to see your doctor, because there is a severe infection. Thank you. Now, you can subscribe, please, if you are not yet subscribed to our channel. And then like and share. Make your comments at the comment section. I am coming to plead also that for the well-wishers, please, you can support us financially too. When you go down to the description, go down to our description, you will find the links that you can do some financial support for us, so we can keep up this, we can grow. You can do by PayPal, you can do by credit cards, you can do by mobile money. The links are down on our description section. Please, you can also write comments or write to me on my WhatsApp. Messages or voicemail only. Don't call. Since the messages are so many, when you call, there's no time for us to pick a call direct. Please leave a message or a voicemail. The numbers 694 35 3141. If you are not in Cameroon, always start with +237 before you add the number. Thank you. Have a nice time.